All right, sprain is where we picked it up yesterday. When you sprain your ankle or you sprain your, like a major joint, it's the ligaments that sometimes they tear, sometimes they're just strained, but a sprain is technically a ligament tear. You can strain your muscles or you can tear your muscles, so I guess like there is such thing as a muscle sprain, I'm pretty sure too. So a muscle sprain is where your muscles would tear, but generally a sprain is when ligaments are damaged. Yeah, it takes a while to heal. Ligaments are not like muscles, as we mentioned before, right? It's not like you can work your ligaments to build them up, to strengthen them. If you tear a muscle or you have an impact to your muscle and you have a sore muscle, you can work that muscle and it actually feels better quicker. But with ligaments, they don't, you gotta let them heal. So people say sprain, they usually mean a twist, or your ankle, if you roll your ankle, like a roll your ankle, that's a sprain. And it's all those little tendons that are attaching the muscles in there, and those get strained. So rice, good way to treat mild sprains as well. Question? Yeah, hi.
No, just something my dad told me is that sometimes they also use mice, which is basically the same thing, but instead of rest, they have mediated exertion.
Okay.
That's mostly
There's mice as well then as rice, and M is mediated exertion, which means just use it lightly.
That's only like recently, so.
Yeah.
It's not.
Well, this is the thing. Like when we talked about this before, you're right. We talked about rest being initial, right after the initial injury. Most of the time, you do have to build that back up. So it's just this is just initially, yeah, the initial, not a long term. You can't stay off it forever, or else it'll never build back up, and it'll always be a problem. Okay, herniated disc. This is the official name for a bulge disc, and I mentioned in class before that I had a bulge disc. I tried to draw it. I don't think I drew it very well, but anyways, here's a better diagram. So a herniated disc is when the cartilage between the vertebrae balloons out from between the discs. This can press on the nerves, cause severe pain. Yes, it does. So it's supposed to be nice and even. I don't have Mr. Skeletal here today, but it's supposed to be nice and even. And if you have some kind of impact that's not even, or even any kind of just even impact, could still squish out somewhere. So it's basically a bulge. That's why they call it a bulge disc. It's herniated. Okay. Lots of nerves around your spine there. Carpal tunnel. Okay, have you heard of carpal tunnel syndrome before? I feel like you used to hear about that more in days gone by, but not as much anymore. But it's basically, it happens in your wrists. It's caused by overuse of your wrist. It causes a pinched median nerve. So in your wrists, you have nerves that come up for your fingers, so you can sense things on your fingers, and so they all kind of have to channel through a small tunnel in your wrist. And so if there's swelling there, or if there's like even deep layers of fat that build up there, then what can happen is you start to feel numbness in your fingers, and it's sort of the way you're built a little bit, like it's hereditary a bit, but overuse, like if you use your hands a lot, like I grew up on the farm and used my hands a lot for a lot of manual labor until I was probably 25 or 26 when I started teaching, I guess, after a few different things. So my hands would start to tingle even when I'm playing guitar. When I'm playing guitar for a long period of time, my hands start to go numb, fall asleep. So it's a bit of it's a bit of genetics, I would say. My mom has it bad, or had it bad. She had surgery, I think, on both her wrists to just to clean out that tunnel a little bit, and just to remove some tissue so that the nerves would be better. But yeah, so carpal tunnel, pinching on your nerves in the wrist area there. All right. Posture issues. Sit up straight. There are also posture conditions. This is when the spine has incorrect curvature. Okay, so when your teacher, your parent tells you to sit up straight, okay, you don't want to be like this, and because over time it's not good for your spine. Your spine's not supposed to be like that. So yeah, sit nice and straight. If you do this too, it helps like this one. Respect.
Which would be strange. If the whole class then sits in this.
Very good. Good posture, everyone. All right. Kyphosis. or kyphosis, I think it is. Actually, I don't really know exactly how you pronounce that. Kyphosis is like humpback. So if you have like an extreme curvature of the spine just below the neck area there. Posture issue caused by bad posture and sedentary lifestyle. A lot of older people kind of get this. Again, it has lots of different factors, but basically if there's an extreme curvature back there, it kind of looks like it's a hump. It's nothing growing, it's just a extreme curvature of the spine. And yeah, you see some people doing that. It's not necessarily because you have a sedentary lifestyle, but that could be contributors of it. Kyphosis, Kyphosis. All right. Lordosis, a sway back. So hips rotated back, making thoracic region move posterior and hips move anterior. So if this is a normal sort of straight up and down spine, it's fairly straight. There's obviously a little bit of curvature to the spine always, but if someone's standing and they have their pelvis is sort of like moved forward like that, that's lordosis, sway back. So you've got a little bit more curvature in the lower part of the spine. The humpback, the kyphosis is extreme curvature in the upper part of the spine. This would be more extreme curvature in the lower part. So, anyways, there you go. Lordosis. Scoliosis. This is another one, and this is a side-to-side abnormal curvature of the spine. Scoliosis. Scoliosis. All right, diagnosis of skeletal system issues. Let's talk about that. Touch and feel, a couple of ways that you can assess the health of a skeletal system. You can use touch to feel if anything's out of place. Okay, obviously if you have a dislocated something, that can be felt pretty easily. If you have a break or a fracture, a lot of pain is usually associated with touching that. So when you hurt your arm or something and the doctor immediately goes to the place that hurts and starts poking around, you're like, no, don't do that, that hurts. But they're trying to find if there's a spot where it's like, that's really, really bad. And then you can kind of, if he or she can feel a lump, or if there's extra swelling there, or if it is extremely painful, then there's a good chance that they can locate a possible break or something like that. X-ray, you can also use imaging technology. The main one is that we'll focus on is the X-ray. MRIs don't really see bone so much. You remember that MRI picture? It's tissue. It's different kinds of tissues. And so there's someone doing looks like the heart there. Okay, that's kind of cool, I guess. So you can see the bones. How many of you have had an X-ray done? Almost everybody? Okay, not quite everybody? Okay. When you see your X-rays for the first time, it's kind of cool. See your bones there, and especially the hands or with all the little bones. It's pretty amazing actually how they all fit together and how they work together. It's pretty cool.
The teeth is really ugly.
The what?
The teeth, man.
Oh, the teeth. Oh yeah, like a scan of the teeth. That's right. Yeah, some of those teeth scans are pretty scary. It's true. Okay, repositioning a bone. So this is under the treatments, okay? Repositioning a bone. Since bone is living tissue and not dead as some people assume, to fix a broken bone, the bone is repositioned into the correct position. So you have a bone set or whatever, right? You can put your bones back in place. A lot of times they're casted. If you have a broken bone, the doctor will put a cast on you so that it'll be held in place, and your bone will literally grow back together and heal up. So you can also have something like a splint, which is basically a kind of a rigid piece of material that's strapped to the bone on the exterior so that it just doesn't move again. A lot of times a full cast depending on where it is. And sometimes if it's your hip, or if it's something that can't cast, or you just have to sit in bed, you just have to lay in bed and try and let it heal on its own for a long period of time. So a lot of times if it's an appendage, arms, legs, you can cast it and still move around a little bit. But there are some bones that you won't be able to do that. All right. Okay, bone pinning. Occasionally, surgery is required to help position the bone and to hold it in place. So this is an x-ray, obviously, where there's a plate and some pins in there. A common injury in older people is the Coles break. This is when the radii, that's the arm bone, breaks at the wrist, often the result of a fall. The bone often has to be pinned into place to allow for it to heal. So pinning doesn't seem real pleasant. Anybody had any bones pinned into place? Anybody broken any bones or anything that bad?
I had a cold spring, but I didn't need pinning.
Oh, okay.
It
Yeah.
stayed in the right spot. So.
Yeah, so your x-rays will be very, very interesting if you have any kind of screws or a plate. So sometimes to keep the bones in the right places, they have to do something like this, which is pretty extreme. They literally drill holes in your bone and screw a plate on there. So it's, ugh. Yeah,
Oh, terrible.
yeah. That would be harsh, yeah.
You are,
And it happens quite often though. Yeah.
you are under the full unconscious, right?
I believe so, yeah, it'd be surgery. It's pretty intense surgery, yeah. No, you wouldn't be
You're not
conscious.
going
It's not like a local and we are watching them, no. All right, exercise and diet. Other bone conditions are often treated with exercise to develop proper bone strength and nutrition to provide the nutrients that bones require. So, yep. Exercise and nutrition helps your muscles, helps your overall health, but also helps your bones quite a bit. Typically, women need to make sure that they're getting enough calcium and magnesium for bone growth. Women have less dense bones to begin with because of body processes that use more calcium and other nutrients, especially at menopause. So, when women get older, there's supplements for both men and women as you age. Some when you're young, some important supplements you take. If you're a woman that is of childbearing age, if you think you might be getting pregnant, or I remember when we were having kids, my wife took some special supplements to kind of make sure that her body had lots of these nutrients that the early developing babies would need. So you guys are fairly healthy. Your body is fairly, because you guys are kind of approaching the prime sort of time of life where your body is the most healthy. So it takes in nutrients really well. You're using things fairly efficiently. Your bone density is just only increasing. So unless you're not on a steady diet of Cheetos and Coke or something, you should be fairly healthy. If you're getting a little bit of exercise and getting sleep and eating properly, you'll be the healthiest you'll ever be. Take it from me. 35 years ago, I was your age, and yeah, been a long time. Start to go downhill just a little bit. No comment. All right, let's see. Okay, excellent. So that's the end of the slides for the notes. That should be the end of your notes, right? You got everything filled out? Okay. All right, so that's the end of the notes for the skeletal system. Oh, there you are, Demi. Eating Cheetos. Oh my goodness. It's like those things just go right through you there. Yeah.